Hello, I'm Dr. Scott Trenhaile. I'd like to take a few moments to discuss with you some important aspects about your upcoming surgery. Please feel free to stop the video and take notes so that we can address your concerns prior to your procedure.
Hello, my name is Alyssa and I'm part of Dr. Trenhaile's nursing team. Prior to surgery, you may be asked to obtain lab work, a history and physical from your primary care physician, and/or clearance from other medical specialists that you are under the care of. Directions for all blood thinners should be coming from their offices. You may also be asked to obtain and use a preoperative skin prep solution prior to your procedure. If you have any questions or concerns, feel free to contact our office.
I'm Michael Gilbertson, Dr. Trenhaile's physician assistant. The day of your surgery, please come to the procedure with a driver that can stay throughout the entirety of your care if an outpatient procedure is to be performed. Please make sure to wear loose-fitting clothing that is easy to put on after your procedure. Once you enter the preoperative holding area, you'll be asked to change into a gown and a nurse will place an IV. In the holding area, you will meet with the anesthesiologist. This is your opportunity to discuss the type of anesthetic you will be receiving for your procedure. Knee surgery patients typically receive general anesthesia in which you will be completely asleep. In addition, it may be recommended that a regional nerve block also be given in combination to the general anesthetic. The block consists of an injection given in the thigh of the operative knee after a sedative is given. During the block, you will be able to breathe on your own, but be unaware that the block procedure is taking place. If a block is recommended, it should provide knee numbness that typically lasts 12 to 24 hours in duration. This will allow you to start your oral pain medication at home as directed while the block wears off. Starting the oral pain medication as the feeling in the knee begins to return allows for a smooth transition between the regional block and the oral medications. Side effects of the block include not only numbness of the knee and leg, but also the inability to move your knee, ankle, and toes. The inability to move your leg typically resolves when the feeling returns or possibly sooner. In the preoperative holding area, Dr. Trenhaile will come and meet with you and sign the surgical site. At this time, you will have the opportunity to ask any final questions before you receive any sedatives or anesthetic medications. The surgery is an arthroscopic procedure which requires the use of multiple portals placed around the knee. The portals are small incisions in the skin about 1/4 of an inch in length which allow access to the various compartments of the knee. A diagnostic arthroscopy is performed and photographs of the knee are taken. You will receive a copy of the photographs on your first postoperative visit in the clinic. During the procedure, the structures within the knee are evaluated and any significant injuries are identified and addressed during the surgery. This would include any tears in the meniscus that are found. Depending on the type of tear that you have in your meniscus, you may have a procedure where the meniscus is trimmed to eliminate the tear. Certain meniscus tears require a repair or sewing the meniscus together. This would be the decision made at the time of your surgery. A chondroplasty will also likely be performed in which the arthritis of the knee is cleaned up. The incisions are then closed with sutures and covered with a dressing. The surgical portion of your procedure will take approximately an hour to complete. In the case of a meniscus trimming, no brace or weight-bearing restrictions will need to be placed. Weight-bearing will be allowed as tolerated while limiting walking. Please make adequate time for rest and elevating the leg for the first 2 to 3 days after surgery. For meniscal repairs, after surgery you will be placed in the knee immobilizer. Your brace should be worn fully extended or straight at all times, day and night, except for times that you are exercising, until otherwise instructed after your first postoperative visit. Plan on wearing the brace approximately 6 weeks after the surgery. Crutches are usually recommended to assist with walking. You are allowed to bear as much weight as tolerated on the operative leg unless otherwise instructed, with the brace on and locked in full extension. So please do not walk without your brace on. You will be given written instructions before leaving the facility on the day of your surgery detailing the limitations that are specific to your procedure. A white absorbent dressing will be placed over your knee. The dressing is applied to keep the portals clean during the healing process. Immediately after surgery, the fluid that is used to distend the knee will leak from the portals and it is then absorbed into the bandage. Occasionally, the fluid will leak beneath the bandage and a towel can be placed under the knee to soak up the fluid. The bandage should not be removed, but instead reinforced with more bandages or a towel. Occasionally, the fluid that comes out of the knee is blood-tinged in color. Don't be alarmed, as this is fairly common. If you have any questions or concerns about the amount of drainage that is occurring, please call the number that is provided to you. The absorbent bandage may be completely removed 48 hours after surgery, and you may take a brief shower. Swelling around the knee is very common at this time. The knee immobilizer is removed and touch-toe weight bearing on the operative leg is allowed for balance. You will likely require assistance getting in and out of the shower on your first couple times. At this point in your recovery, I do not recommend any prolonged exposure to water, including bathtubs, swimming pools, or hot tubs. After the shower, you may towel dry the surgical site and apply Band-Aids to all the surgical incisions. Don't try to clean the operative soap from the knee, as it has to exfoliate or wear off with time. Early exercises are allowed to begin the rehabilitative process. It is not uncommon to have your first physical therapy appointment prior to seeing our team for your first post-op visit. You may begin exercises at home 24 hours after surgery to include quad sets, heel slides, and ankle pumps, unless otherwise instructed. Performing ankle pumps continuously throughout the day will help to reduce the risk of developing a blood clot in your calf. It is safe to bend your knee in a non-weight bearing position when performing exercises unless otherwise instructed. Elevation of the leg above chest level will aid in the reduction of swelling and help to reduce the pain in your knee. Avoid driving until you are seen back in the office at the 7 to 10 day mark after surgery. Further recommendations may then be given on your first postoperative appointment. During this visit, we will discuss with you the arthroscopic photos that were taken at the time of your surgery and also discuss the next steps in your rehabilitative process, including physical therapy and brace timeframes. You may have sutures that will be removed on this visit as well. While each circumstance is unique, patients are typically prescribed postoperative pain medication and nonsteroidal anti-inflammatory medications. We will provide you the prescription of your pain medicine today to assure timely filling of the medication prior to surgery. We ask that you please do not take the pain medication until after the completion of your surgery. These medications are for home use only and will not need to be brought with you on the day of your surgery. The medications are chosen so that they may be taken together safely as long as you follow the directions on the pill bottles from the pharmacy. Basic risks associated with any surgery include, but are not limited to, things like blood clots, infections, failure of the procedure, implants, nerve damage, and need to repeat surgery. You will be given a dose of antibiotics through your IV before the surgery to reduce your risk of infections. If you are experiencing fevers, chills, night sweats, or excessive draining from the incisions, please call the office immediately. As we get closer to your surgical date, your time for surgery will be released. If your surgery is on a Monday, you will receive a call from our office prior to 3 p.m. on the Friday preceding. For all other surgery dates, you will be notified by 3 p.m. the day before your surgery. It is important that you inform our healthcare team of all medications that you take on a regular basis, including supplements and over-the-counter medications. You may be asked to stop some of these medications prior to surgery. Remember, nothing to eat or drink after midnight the night before your surgery. Thank you for your attention, and we will now be in to answer any further questions that you have.